Assalamualaikum doctors. In this video, I am discussing the management of torticollis. So first, we am telling the definition of torticollis. That is, look, short, tight sternocleidomastoid muscles. So one side like that, head will be one side. Chief complaints. Child may be infant 3 months age old in the history. So torticollis is the persistent tilting of the head to one side, not a diagnosis. It is a clinical sign of an underlying pathology. What are the causes of torticollis? That is congenital, acquired causes, and life-threatening cause. So congenital are like congenital muscular torticollis, that is sternocleidomastoid shortening, the most common cause. Cervical spine malformation, that is spina bifida. Arnold-Chiari malformation, Klippel-Field syndrome, atlantoaxial fusion, birth trauma, or antenatal complications. Acquired causes occur after 4 to 6 months. When acquired causes, that is sternocleidomastoid or trapezius muscle injury or inflammation, causes the chin pointing towards the opposite side and ear or head tilted to the affected shoulder. Cervical muscle spasm or cervical nerve irritations, acute infections with muscle spasm, that is pharyngitis or cervical lymphadenitis, Quinsy upper respiratory tract infection, trochlear nerve palsy, and Sandifer syndrome. Life-threatening causes is retropharyngeal abscess like fever, irritability, drooling, limitation of neck extension, and using eyes only for upward gaze. So retropharyngeal abscess, they have drooling present, fever, irritability, and C spine, cervical spine injury like histophrenic trauma, findings not typical of sternocleidomastoid spasm, CNS tumors like posterior fossa, spinal epidural hematoma, or suppurative jugular thrombophlebitis. Okay. So when we take the torticollis history, any history, we'll remember the red flag symptoms we keep in our mind. Like any neck stiffness, inability to extend the neck, fever, drooling or vomiting, pain increasing, unremitting or disturbed sleeps, then recent any trauma, repeated hospital attendances with persistence of the symptoms, gait disturbance and history of headache or changes in behavior. So red flags are neck stiffness, inability to extend neck, fever, drooling or vomiting, pain increasing, unremitting or disturbed sleep, recent any trauma, repeated hospital attendances with persistence of the symptoms, gait disturbance, history of headaches or change in behavior. Now investigation, what we do, imaging to consider, discuss with your senior and pediatric radiologist. Cervical spine x-ray, persistent symptoms more than 1 week, severe pain, limited range of movement after analgesia, underlying condition causing ligamentous laxity. CT scan of neck for retropharyngeal abscess or bony injury, MRI brain for concerns, posterior fossa tumor, spinal malignancy and ligamentous injury. Then ultrasound of the neck in infants. Okay. So we are doing, these are investigation mainly cervical spine x-ray, CT neck, MRI brain for concerns and ultrasound neck in infants. Management, what we do, typical age and presentation for simple muscle spasm or injury, analgesia return if symptoms have not resolved after 7 to 10 days, and red flags. So 7 to 10 days if not simple muscle spasm can be. And red flags or concerning features like trauma, head tilt not typical for simple muscle spasm, urgent discussion with the senior. If it is not torticollis for sternocleidomastoid by born, then we will urgent discussion with the senior. Do not attempt to move neck. Allow the child to maintain position of comfort. Provide analgesia, appropriate imaging, X-ray, CT and MRI, formal ophthalmology examinations, IV antibiotics and urgent ENT review if suspecting retropharyngeal abscess. If imaging suggestive of atlantoaxial rotary subluxation, discuss with the pediatric neurosurgery. What is the medical treatment? That is stretching exercises, botulinum toxin, anticholinergic agents, analgesics, muscle relaxants, seizure medications if needed, and surgical treatment if needed. So treatment of torticollis are first of all stretching exercise, botulinum toxin, anticholinergic agents, analgesics, muscle relaxants, seizure medications if needed, and surgical treatment if needed. If torticollis with plagiocephaly without red flags, reassure and the follow-up advice. So plagiocephaly one come that is head is abnormal shape, encourage tummy position, feeding on alternate side, change bed position, encouraging baby to see his mom on other side. Red flag to seek medical advice. No need for helmet in plagiocephaly. It is resolved 6 months and it can restrict expansion of the brain and skull development. So we will not in plagiocephaly give any helmet. It resolves in 6 months. Remember, it can restrict the expansion of the brain and skull development. Plagiocephaly, we give the advice, encourage tummy positions, feeding on alternate side, change bed position, encouraging baby to see his mom and other side, and red flag to seek medical advice. Thank you.